Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome back for another version of our Facebook Live. Tonight we're going to be talking about small procedures that make a big difference. Right now we're in the throes of summer and maybe surgery is not fitting into your timeline for vacations, kids getting ready to go back to school. So we're going to talk tonight about some little things that you can do with very little to no downtime that will make a big difference, subtle changes, and that might give you that appearance or that refreshed look that you're going for. Tonight I have Pamela joining me again. So everybody knows Pam. This is our nurse injector here. And we have our live mannequin demonstrator is going to be Beth. So I hope everybody is tuned in. And if you have any questions, please let us know as we kick it off. So I'm going to kick it over to Pam right now, and she can kind of go through a couple of things to start us.
Are we starting?
Talking about putting you on the spot.
Right.
We'll start with cleft chin.
Okay, well, you might want to start with this.
All right, I'll take
It's
it.
a surgical procedure, but there's also an alternative for a dermal filler.
Right. So some people are born with a cleft right in the middle of their chin. Some people get them because they've had a cyst or some type of a trauma, some scarring, and so you can have a little crevice or even a dimple in the middle of your chin. Some people find that attractive, it bothers other people. So in the past, we have tried to release the scar tissue, and that is a very simple surgical procedure. Can you do that under local anesthesia? It actually can be done in the office sometimes. But there are ways of also filling in that cleft or that divot, if you will, and volumizing it. So some of the new ways of doing it, obviously we've heard a lot about fat injections, and so you can put a little bit of fat in there. But sometimes even after we release the scar, there can also still be a little bit of that crevice, and that's when I have patients see Pam to talk about putting in dermal fillers. So you can use anything long-acting. We like to use Juvederm. You can probably use Voluma in that
Voluma
area.
would be a good one. It would create, it depends on how much volume is needed in the area and how much volume you want to create. So that would be between a couple different fillers, either Juvederm or Juvederm Voluma would be the two best products to use there.
Right, and sometimes when you need to sort of be examined for it, because sometimes the clefts are deep, and that's when you really need to release that scar tissue or that tethering point to allow that to release the tension. Then when you put the filler in, it would really expand. Otherwise, if you don't release it, it's not going to expand that much. And sometimes it's just because you have a little bit of a scar and there's no tethering point, and that's when just going to a straight dermal filler would be okay.
You mentioned the jawline. Can you add filler to create a stronger jawline or change
Yes, we use derma fillers for different areas on the jawline. Some women, if they are losing mid-face volume, we bring up here and put the Voluma here, but you can also pull back this way and put a little on the jawline. Right here in the chin area is a good place because it spreads the skin out and creates volume on the bony surfaces here. So women that get a lot of lines here, that's usually their first thing that they want. They don't want to see that. Is there any way we can create volume there to spread that out a little bit? And that's where we go to the mid-face first, but you can come down on the jawline and even in the chin area.
The other place that we've had some success with patients that are thinking about either a chin implant or kind of pulling that profile out a little bit is that we've actually had some success putting in dermal filler here. And because it's a non-mobile area, you should get maybe 1 to 2 years of results. So if you're not really interested in having a chin implant or a permanent implant, or you're kind of kicking around the idea, you're not sure you want to have that done, you can actually have a dermal filler placed and bring that chin out a little bit and just add some volume right here, and that kind of pulls it forward, and that can also highlight your jawline as Pam sculpts the jawline. You can actually add a little volume there too to kind of bring it forward.
Nice.
So we've had some very nice results with that. Another nice thing about that, there's no downtime. You can go right back to normal activity the following day, and there's no incisions.
men or women?
Men and women,
Yes.
yes.
Can it, if you have filler there, does it change their expression when they're talking, or can you note it? Someone that's talking to them, do they notice that the filler's there?
It's a very subtle result, I mean, we're talking about, changing the profile several millimeters. So it's not trying to bring it out a whole lot. It's really just sort of adding to that volume. But I don't think anybody's ever commented that.
No, they've not. I always tell them for the first 2 hours, it may feel funny, like when you're communicating with somebody, just because it has lidocaine. So you may feel that numbness, but 2 hours after that, it's going to be right back to normal.
Good question. The other thing we want to talk about tonight, which is a big topic always, is earlobes. Some patients have elongated earlobes, so they're seeing too much of the lobe. Some people have thinning earlobes. So I've had several ladies over the past coming in, and their earlobes have actually lost volume, and so now they're kind of hanging, but they're very thinned out. That also leads to, or one of the reasons that earrings can pull through. So one of the most common minor procedures that I do are actually fixing earlobes that earrings have either pulled through or or almost completely pulled through. So it's very difficult for a woman to wear an earring. And the other is obviously the younger crowd wearing gauges. I've been repairing earlobes that have had gauges in them for more than a decade now, I would say. Well more than that, because we were fixing those before we moved here. So that's another common area. So one of the things we want to show you on Beth is young, and she has very thick, youthful looking earlobes, but sometimes over genetics more than anything, more than the aging process, sometimes the earlobes can lose some of this volume and actually thin and hang downward like this. So an earlobe reduction is a very easy surgery to do. And that can be done sometimes with just making some incisions right along the side and reducing it. Depending upon what you need, you can also take some wedges out and shorten it by just taking the wedges out and bringing that up also for a better contour. She has a nice earring in here, and if that actually pulls through or elongates, then what we can do is actually go in and remove the skin that has grown down into that channel and repair that so that she can continue to wear piercings in the future. So those are easy things to fix. The gauges can be challenging depending upon obviously the diameter of the gauge, how long it's been in. I see some that are extremely large, and sometimes there's really not a whole lot you can do except just sort of amputate that skin. But if the gauge isn't very large, you can actually reconstruct the earlobe in different ways and get a very nice result. So actually close down that hole and give some very nice contour so that people that don't know you had gauges before would probably not know that you had them ever. So there's some good things out there for people that need their earlobes repaired.
Didn't one of the Kardashians or Kris Jenner just had her earlobes done recently? That was a newsworthy event in Los Angeles.
Another thing you can do as well, if you don't want to do a surgical approach, if you have the where the hole gets elongated, you can fill the lobe with some dermal filler and just puff that back out, and then it'll look more like a youthful ear. It won't last as long as a surgical procedure that's more permanent, but if you don't want any downtime, that's also an option.
Right, and again, because the earlobe is not a mobile area, you should get some pretty good,
It'll last a while.
long time lasting for that.
So the filler is a non-surgical approach versus a surgical approach.
Right. The nice thing is the earlobe doesn't have a lot of sensory nerves in it, so most of that surgery can be done under local anesthesia. I do most of them in the surgery center that I use, and it's a very quick in and out surgery. But there are stitches, and so sometimes you need to do that. But what Pam's talking about, which is a very efficient way of doing it as well, is adding that volume. That's a quick 15-minute procedure in the office using a needle, so there's no downtime.
Pam, Tara wanted to say you look so pretty.
Oh, thanks, Tara.
And TD says, hello.
Hello.
Next we're going to talk about tear trough augmentation.
All right, this is one of Pam's specialties, so I'll let her head that.
Yeah, we get a lot of women who are concerned about hollowness underneath the eye. Now, we're not talking about the puffiness there. The puffiness then goes back to Dr. Antimarino as a surgical procedure to remove some of the fat there to correct that. when you have hollowness or dark circles under your eyes and you see distinct lines where you need some volume there, we do augment that with a dermal filler, and that product lays right in underneath the eye, and we did demonstrate that last time. Gives you a nice fullness underneath here to be nice and smooth. That lasts about 8 months. No downtime, once again. Pretty comfortable. There's not a lot of nerve endings there either, and I do use a cannula to inject underneath the eye. So usually there's very minimal to no bruising, and it's no downtime. Like I said, they go right back out to work or wherever they're going with a nice filler under there that you can't see.
Right. I think it's something that's becoming more popular with men as well, because even as men
I've done
age,
it on
we have
men
the
as well.
same. We have the same issues, and you can get some hollowing, and then the skin kind of coalesces, and that can give you either some shadowing that causes some darkening or a darkened circle, or it's just the amount of skin that sort of has folded together. So sometimes building that area back up non-surgically is a nice way to do it as well.
And you said that helps with discoloration?
It can lighten the discoloration because you're putting a filler in there, which is creating like a camouflage of the coloring. So sometimes it may still be there, but a little lighter.
Yeah, and I think one thing you have to be careful of when you're evaluated or you're thinking about having this done. This is the area that I would really recommend that you go to a medical spa because you really do need to be evaluated. We've had some patients that have come in with sort of the herniated fat or the bags under their eyes, and the contouring has the shadowing from the bulge has caused a little bit of a sulcus here, right at the junction of the cheek and the lid, because you have some bulging here. That can cause a sort of a sulcus or an indentation here, and some darkening or a darkened circle. The last thing you want to do in that case is put dermal filler there, because now all you're going to do is make that bulging look worse.
Right.
And so if you go to a place that's really not as a medical spa, they may not understand that principle and actually make you look worse. So in that case, you really do need a surgical procedure to actually remove those fatty deposits and redrape the skin versus just using a dermal filler. So if you don't have any bulging and you really have that hollowing in here, then dermal fillers is really a nice way to do it.
Sherry writes, my husband had a spot on his nose that he had a biopsy taken. Now there's a slight indentation. Would any filler help with that?
If it's a scarred area.
Yeah, it's a little bit harder when it's a scarred area. It can, and just like I was talking about with the cleft, I think it's something that needs to be evaluated. Sometimes you can have a scar if that skin is still mobile, and this is how I would look at it. If I can touch where the scar is and move that skin a little bit, that means that the scar can probably be filled with a dermal filler. If the scar goes down to the covering of the cartilage because the cancer or the biopsy went down that far, then you'd have to release that scar to have the dermal filler help. So I
Yeah,
think
it
that's what I
depends on
would do. And again, that's why it's important sometimes to be at a medical spa so that somebody can evaluate the difference. It's easy just to say, I'll just put a dermal filler in, but if it's tethered, there's no way for that dermal filler to actually produce volume to decrease that divot. So you have to release it at the bottom.
Nancy says, Dr. Antimarino and Pam, you are the best.
Well, thank you,
Thank
Nancy.
you.
Our next topic I want to talk about, I just saw recently that Kathy Lee was speaking out about her experience with the AeroLace laser, which excitedly is the laser we have in our office. So Pam, do you want to tell us a little bit about what that laser does?
Yes, our AeroLace laser is a great procedure to do on your face, and it helps with fine lines, pores, it tightens skin, it'll help any pigmentation issues with dark spots, brown spots, red spots, all at the same time, and it also hair removes. So it's a nice procedure to do. We recommend a series of 3, about 6 weeks apart, just to get a nice overall texture on the face. No downtime. It doesn't matter what Fitzpatrick scale you are. the color of your skin. It's great for all colors, and it doesn't matter what time of year you do it either. So it's a really nice procedure to do all year round. Like I said, we do recommend a series of 3 just to get the best result, and then maybe just as a maintenance, it'll be a continued maintenance of keeping your skin nice and tight.
Yeah, it's, you know what, it really is a nice laser. It really works well on sun damage, and about this time of year and later on as you go into the fall, it's really a nice way to clean up your skin. We looked at a lot of lasers over about a 2-year period, and we chose the Aerolace. And I can tell you, we've had it now in our practice for just about a year. We started it last August, and I've been very pleased with the results as well as the patients. It's a gentle laser. There's just no downtime with it. But the one thing I want to caution you again, if you're going to do something like that, it's not just hitting it with the laser. If you're really serious about your skin care, then I would encourage you to have a formal consultation. And here we have, well, Pam, but we have a terrific esthetician, Tara, you've all seen and met. She's really great at evaluating your skin. Think about the laser treatment like going to the gym, you have a trainer. And you're going to see the trainer once a month or once a week or something, but there's got to be maintenance in between your visits. So they're going to instruct you and help you. So the laser really cleans up your skin, but you need to be on a regular regimen throughout or in between those treatments. And then after those series of 3, you need to be on it continuously. So that's where somebody like Tara comes into play, that you might need to be on Retin-A or some type of definitely sunscreen, some skin protection. So there are different skin protocols that might be better for you, and in conjunction with the laser. That way you get more out of the laser treatment, you get longevity out of those treatments, and then you really only need a maintenance about, yearly. We would look at you and maybe doing it once or twice a year to keep up with that skin. So I would recommend anybody serious about their skin who's thinking of a laser, you have to think of it like I explained it. It's not the end-all, be-all, cure-all. It's a part of a protocol to get your skin in shape and then keep it that way.
We also saw great results with acne scarring, active acne, and Tara's done a few treatments and it turned her out with great results.
Right.
Lightening of melasma is another great thing that we've seen with it. So
Right. And down on the décolleté, then the neck, and also on the back of the hands.
Telangiectasias, the little
cherry angiomas, they'll take all those away.
Right.
Yeah.
So it's really a very versatile laser.
Yes.
So again, a small procedure that makes a big difference.
Absolutely.
And now we're talking about the nose, what we can do for the nose.
The nose has kind of taken off in the past less than a year. So in the past it was always a rhinoplasty or a surgical procedure, but nowadays we can use dermal fillers to really help change the shape of a nose, do some subtle things. Again, small procedures making a big difference. Instead of having to undergo a rhinoplasty. Now, there are things that only a rhinoplasty can treat. And so if you're having problems with breathing, you've had fractures of your nose in the past, if your nose is very wide, those are things that only a surgical procedure can correct. If you have a kind of a bulbous tip, then again, that's a surgical procedure. But if you're somebody who doesn't like some subtle things about your nose, that doesn't have them, but we'll demonstrate a little bit. So if you're somebody that has that concavity, sometimes people have this concavity here and then it comes out to their nose and they're bothered by that. The top of the nose in this area is called the radix, and sometimes we can build up the radix so that the nose looks straighter. You can also add dermal filler right on the dorsum or the top of the nose, right in here, again, to make that look a little bit straighter. If you have a little bit of crookedness to your nose, where it's off to one side more than the other, then you can actually add some filler in to camouflage that defect. There's a way to use the filler right at the tip, and some patients have a little bit of a downturn of their tip, and so the dermal filler can actually lift the tip up a little bit. And we're talking, again, millimeters that make a big difference. We've, just like Sherry had written in, sometimes patients either have developed or just by over just the course of developing their nose or some type of trauma, sometimes you can have some little irregularities, some little divots. And so again, the dermal fillers can help fill in those gaps to make your nose change the appearance in a subtle way. And so patients that really just want some subtle changes to their nose, not looking for surgery, you may be a candidate to do this. Again, you would need to be evaluated by somebody who understands the limitations of what this can do and what you can do surgically. So you want to be evaluated by somebody who understands both sides.
I think that's important as well, because sometimes if somebody had rhinoplasty before, you may not be a candidate for dermal fillers.
Right.
There may be some issues there that you just may not have the blood flow there, so they don't recommend it. So that's why it's very important to see somebody who understands the structure of the nose before, after surgery, all those things, to see whether you're a candidate for that.
Is the injectable painful when you do it to the nose?
People seem very comfortable. We use some topical numbing, leave that on for 15-20 minutes, and I've not had anybody complain that it was uncomfortable at all.
Right, and the Restylane that we're using has some lidocaine in it.
So
the topical really takes away that sensation of that initial needle stick. But once you inject it, we've not had anybody uncomfortable, and then the lidocaine that's mixed with the Restylane really does take away any of the other pain. And we haven't had anybody come back in afterwards saying once it wore off that they were in pain. So I think it's very tolerable for both men and women.
And how long does that last, that procedure?
Depending on what you're doing on somebody, I think it's different for everybody, but I tell them it's probably going to last about 8 months is average.
Yeah, I would
They
say
may
at
get
least
longer.
8 months. I wouldn't be surprised if you got well over a year on it, because again, it's not an area of a lot of animation or movement, so that dermal filler is probably pretty stable in there. The one thing I would caution you is that you don't want to, once it's in, you don't want to start manipulating your nose, and because you can move it around, and so you want to give it a couple of days so that it molds into position, and then you can pretty much free to do what you want to do.
Another procedure that people are asking us a lot about, men and women, is the fat pad underneath the chin, which Beth here does not have either. And we can use a product underneath there, which is called Kybella. Kybella is an injectable. It goes in, ligases the fat, and then it takes a series of a few treatments, but it'll ligase the fat and retract the skin, so it gives you a nice profile, something like she has already. Or you could be a surgical candidate for that as well, for liposuction.
Right, that's an area that is frequently an area of liposuction, especially when you're doing a facelift. I like to do that, but some people just have a little bit of fat there. We're doing liposuction in other places, so if I'm going to go to the operating room and that's one of the areas, it's very easy. It's just a small little incision right at the base of the chin, and you can access all of that. So either way, Kybella works very well, and it's a series. So for most people, it's about 2. Again, depending upon how much fat pad you have there, it can be 2, it can be even 3 or 4 treatments, and again, they're about 4 to 6 weeks apart. But the Kybella actually works well. We're actually using Kybella for other areas as well. So one of the big things that bother women, especially this time of year in bikinis, is that little roll or little ball of fat that's right at the front part of your armpit. And it usually causes a crease between the little ball of fat and the breast. And working out has no effect on it. Exercising, as I said, or dieting doesn't really have any effect. It's just a very localized collection of fatty tissue. Kybella is something that you could do there. In the past, we've just liposuctioned the area, especially when we're doing breast surgery or any other type of liposuction even. That's a very easy accessed area from a surgical standpoint, but now we can really attack it in a non-surgical way, and there's no downtime for that as well. So again, it probably would take at least 1 to 2 treatments. depending upon what you had. So those are areas that Kybella can be very effective as well.
So would you come in for a consultation and then between the two of you, it would be discussed best treatment modality?
Right, and that's how we normally do it. Most of the time, when I'm seeing a patient, they bring it up to me. Then I'll have them meet with Pam at the same time, and we'll kind of the patient and Pam and I will talk about it and kind of come up with a game plan. So we evaluate together.
We're not gonna ask Beth to see her.
Yeah. Exactly.
Aren't you glad?
All right. Well, I hope this answers some questions. I hope these are some things that you may want to inquire about, especially with the skin care and all of the non-surgical approaches we've talked about tonight. I want to remind everybody that we are giving away our summertime basket. You have about a week left. August 1st is the drawing. You can enter on Facebook on the pinned post. Yeah, this is all new to me. So on the pinned post, and that's how you can enter. The other thing that I'd like to encourage people, we talked about it about a month ago. We're doing a sunscreen and hat drive. This is for the Pittsburgh Women's Shelter. This is a really good cause, and I'd like to have anybody encouraged to drop off either at the Shady Side office here or in our Monroeville office. Please drop off some sunscreen or hats that we give to the women's shelter. They're very appreciative for it, and any little bit can help. So I encourage everybody to do that. I think, is there any other announcements, Ellen?
No.
Go. So anyway, again, thank you so much. I hope you're having a good summer. You can visit us on our website, www.bellissimoplasticsurgery.com. Visit us on Facebook, Pinterest, Instagram, social media. How's that? So we'll go with that. I want to thank Beth for coming in and being our mannequin. Thanks again for Pamela for showing up tonight. And of course, I've kept you here all day working. So, but anyway, thank you again. We like doing these. We'll be back next month, and I don't know the topic yet, but we'll let you know.